Hi guys, I'm Sarah Levant and welcome back to my YouTube channel. Today we are going to be talking all about the number one fear, or what I would say is the number one fear with most women when they think about having a baby: vaginal tearing, and mostly how to avoid a tear. What are the factors that help to contribute to keeping that vagina nice and intact and put together? But before I do that, don't forget to subscribe down below, and then if you want to hang out with me live and online and learn all there is to know about childbirth, everything from stages of labor to pushing to postpartum, then go ahead and go to bundlebirth.com and you can sign up for my live online childbirth classes there. Let's get started. Ready to talk about the vagina? I always talk about the vagina. What's new? When I start working with a client, one of the number one things that I find that they're concerned about is their vagina tearing open. Which I get it. I wouldn't want my vagina to tear open, and when you think about your vagina tearing open, that sounds pretty awful. Are there ways that you can prevent tearing? Yes. We're gonna talk about them. But first of all, let's talk about, when we talk about tearing, what are we really talking about? So in general, when we talk about tears are graded from 1st to 4th degree. 1st degree is just like a little tear open. Sometimes they throw a stitch in it, sometimes they don't. Not a big deal, tiny little tear, heals very well. 2nd degree is probably the most common for a first-time mom, where it tears a little bit more than just like a meh, and it definitely requires some suturing or some stitches, but also not a terrible tear, just a little bit of the tissues separating themselves. The bad tears that you've heard horror stories about are considered 3rd or 4th degree tears. So when we talk about tearing, you have to understand that there are different degrees of tearing. And in general, when people say tearing, it's important to understand, are we talking about like one of the really bad tears here? Or are we talking about like the meh, not so bad, like you get a scrape in your skin, throw a stitch in it, and you're good to go type tears? The other question is, where are the tears happening? Obviously, they're happening to your vagina hole. When we talk about degrees of tearing, we're talking about tears usually, mind you, a tear can happen anywhere, but we're talking about the space between your vagina hole and your booty hole. That area is called your perineum. And I do this because we're gonna talk about perineal massage in a second. And so when we talk about the perineum, or what stretches and needs to accommodate the baby, that's the area that we're talking about. I would say from my experience that the best way to avoid a tear is allowing time for the baby to come out. Those tissues are made to stretch. Your body was made to accommodate or let the baby through and stretch out like that. But the faster that it happens, the more likely there is for a tear. So instead, what would this look like? It would mean that you have ideally a slow, controlled push, and that you trust in your body, that it knows how to stretch like that you trust in your baby, the head is capable of stretching you out, and then trusting in your provider. So you've hired a provider / you've chosen a doctor or a midwife, you've gone to them to see them for your pregnancy if that's what you've chosen to do. And so they're there to utilize their expertise to help you. If you have an epidural, or even sometimes if you don't have an epidural, a lot of times your doctor will coach you in that moment to blow and breathe and either stop pushing or only push a little bit in that moment, versus the like really strong hard pushes that you've been giving up until this point. Once you get to crowning or almost crowning, they're gonna likely say stop, blow, wait, let the tissues stretch. Let the tissue stretch till the head is through, and then the shoulders can come through. If you don't have an epidural, what would happen likely prior to this crowning part, and by crowning, I just mean literally like the vagina hole is like a crown around the baby's head. And before here, you likely have an overwhelming urge to push. Like if you were trying not to push, there would be no way that you would just feel like you had to push no matter what. Even if you're trying to resist it, your body is pushing for you. Once you get to crowning, what happens is, and people will complain of what's called the ring of fire. And the ring of fire is just a burning sensation around your vagina hole. And what happens then is you have this overwhelming urge to push, where you're pushing with all of your might, and then all of a sudden it burns around the hole. And what does it do naturally? It makes you go, ah, and hold back. What does that do? That allows for more time for that head on the perineum or the vagina hole to stretch it out, give it a second, and then continue to push through. Moral of the story is listen to your instinct and to what your body is telling you to do. There are some other things that I'm sure you've heard about or that I'm about to tell you that you can do that can help to decrease your risk for tearing. One of them is warm compresses. So a warm compress would basically be that you get some warm water, you get a washcloth in there, put the washcloth in the water, wring it around, and then squeeze it out so it's warm. And then between pushes, you would just hold it on the vagina hole. So if your vagina hole is like this, you just hold it up there, and that makes the tissues warm. Imagine if you're gonna stretch. Ideally, you want your muscles to be nice and warm. So maybe you run for a while, or you do some sort of cardio of some sort, and you move those muscles to warm them up so that they're more stretchy. It's the exact same idea with your perineum. So the research does show that if you use warm compresses, it can decrease the likelihood of those really bad tears. But as far as just tearing in general, there really isn't any good research that shows that it makes that much of a difference for either tearing or not tearing at all. Another popular thing is what's called perineal massage. So again, your perineum is just your vagina hole. You want some sort of lube, whether that be like a coconut oil or some sort of oil, like natural oil, unscented like lubricant. And you can also have your partner do this if you want. Usually they tell you to do it in the shower just because it's warm and it's easy access down there. But basically you would take your two fingers and then you would rub gently across the bottom part of the vagina hole, okay? And you're rubbing to the point that like it's a little uncomfortable and it's pulling, but it should never be painful. And if you were to bleed or swell up, like that is way too much pressure, okay? This is just enough that it's kind of preparing the tissues, softening them out. You may also find that during pushing, your provider, meaning like doctor, nurse, midwife, when they're pushing with you, they may use some sort of lubricant and run their fingers across the bottom part of your vagina hole to help prepare it and stretch it out. This shouldn't be that uncomfortable, but it would more be like a massage. Like you think about like a nice massage, not like a deep tissue massage in your vagina. Some providers really like doing that, and other providers are very hands-off. So talk to your doctor about what they do, what they suggest. But as far as doing perineal massage ahead of time, usually people would start perineal massage around 34 weeks. The research on this is actually super limited or inconsistent. There isn't really a consensus whether or not the perineal massage prior to delivery or during delivery really helps all that much. But I always say to my clients, if it's going to help you with peace of mind to know that you've done something or anything within your power prior to your labor and birth, then go ahead and do it. No harm done whatsoever. Another thing that people talk about is the position that you deliver in. And so does it really make a difference what position you deliver in or not? So the answer to this one is a little bit complicated. In general, it doesn't make that much of a difference for tearing versus not tearing. Now, where it makes a difference is when you're talking about the bad tears and avoiding the really bad tears. When we're talking about the bad tears, there is research that shows that laying on your side for pushing or being upright, so like a squatting position or an all fours position or even like a standing squat position, does decrease your likelihood for third or fourth degree tears, so like the really bad tears, and then also an episiotomy. That could be another YouTube video. If you want it, just throw it down in the comment box below. There's also one study that shows that if you have an epidural and you wait to labor down or until you feel the urge to push and you push on your side, that can decrease the likelihood of no tear at all. I think there's a lot of bad rap also about pushing on your back, which for other reasons other than tearing, there's benefit for, but in general, if we're strictly talking about tearing, pushing on your back versus your side versus upright or whatever, the data is super limited related to avoiding tears altogether. But as far as avoiding like the really bad tears, it does seem to be better to be on your side or upright versus on your back. And then last but not least, people will relate having an epidural to a higher instance of tearing. First of all, it's a little complex as well. So in general, does an epidural cause there to be a higher likelihood of tears? I would almost say from my experience that the answer is no, because the highest chance of avoiding a tear is when you have a ton of control when you're pushing. And guess what? With an epidural, you're not feeling the pain like you're feeling without the epidural, or the urge like you would feel without an epidural. And so when it comes to getting to this point when your provider says, okay, blow, breathe, wait, don't push anymore, you can. You can just sit there and be like, okay, tell me when to push. They're like, push to 3. You're like, and that's it. Versus without an epidural, you're like, and they're like, stop pushing, you're like, where the research is pretty clear, and I think where probably it's gotten skewed and why it's important to understand that there's like 1st to 4th degree tears is related to those really bad tears. So like the 3rd and 4th degree tears, there is a correlation with having an epidural and having a 3rd or a 4th degree tear. And likely where the cause comes from is the fact that if you have an epidural, you have a higher instance of what's called an operative vaginal birth, which means using forceps or a vacuum. And with forceps or a vacuum, with or without an epidural, you have a higher risk of tearing. This is like really complicated. So what I can tell you from clinical studies is decreased likelihood of 3rd to 4th degrees. What's the instance of tearing? Most first-time moms will have a little bit of a tear. To have a completely, what we say, intact perineum is pretty rare, but by a tiny bit, I mean the like little separation in the tissues. Sometimes you don't even have to do anything, or if you do, a few little stitches in, a couple weeks out, you're feeling a lot better, and those tissues are healing up really nicely. I think the studies show that it's like 50 something to 78 or 9% of women will have some sort of tear. But is it possible? Have I seen first time moms that haven't torn? Absolutely. Have I seen second time moms that haven't torn? More likely, yes, or the more babies you have, the more your vagina's already stretched like that, and it's like ready to stretch again, like that. Ultimately, what I wanna remind you is to just trust in your body, trust in your baby, trust in your provider as they guide you while you're pushing. Control those pushes, throw some warm compresses on, let them do a perineal massage if they want. Labor really in the position that you feel comfortable in, and then trust in your vagina that it knows what to do and it knows how to heal yourself if you do have a little bit of a tear. And understand that those tissues were made to stretch like that. They were made to recover really, really well. Thanks everyone for being with me here today. Don't forget to subscribe, like, comment below. If you want to come to my childbirth class from anywhere in the world, go ahead and go to bundlebirth.com. It's all linked down in the comment box below. And until next time, don't forget to flex and flow, and I will see you soon. Bye guys. But let's talk about your vagina tearing. Vagina. Or say like you run a lap around a field, around the park. A real lap? You just run a lap. Just run some sort of lap. Come to a childbirth class. I now have live childbirth classes. Ooh, let's talk all about your vagina tearing open. I don't wait. Let's try that again. One, baby's nudging come out versus it just like bam, blow those tissues right open. Football. The second degree, about what position, which is like your this kind of pushing position. Oh, that's a good angle. Oh no. I so appreciate you spending your time with me. Doesn't just split, it's what we call a vaginus. When we talk about 1, 2, or 3, or 4 degrees of your vagina tears in your vagina opening, no. When we're talking about like the worser tears, bye. Bye. I sound like a goat. Bye. Bye. See ya.